Okay, so this is the setup and procedure for a routine extraction. So everything needs to be in a bag over here, and we're going to open things aseptically. So we start with our drape. So open this up. Now you're only allowed to touch the plastic surface. You cannot touch the paper side. So be careful when you open this up. You cannot touch anything. The bracket, anything. We're only handling the plastic and straight over your drape like that. Okay, that's very important. Then we're just going to go with our basic mirror tweezer probe. This is also opened up aseptically. Very careful you don't let that bag touch the drape or those instruments drop on the ground. I'm also going to need some sort of elevator. A Coops 2 is probably the most common one. A Coops one's number 2. Once again, open up aseptically. Good. Got some forceps here. So whatever tooth number you're given, you need to get the appropriate forceps. Once again, aseptically. I've also got a suction tube, which I just like to pop on and leave the bag on, so it's protected. I'm also going to have some gauze here, that's very important. 2 of those. Get rid of my bags. And some tweezers for me on my side. Now these need to be opened aseptically also. So make sure you peel the bag back all the way and just leave it sitting on your nurse's side like that. Because I'm going to come and tidy up that bracket. We would never present it in a mess like that because I can't touch anything. You have to use your sterile tweezers. This way, when I put them back down, the working end is still sterile because it's only touched things that have been sterilised. Like that. I've also got some LA. So what's the procedure? Patient comes in, checks the medical history, some LA, wait for that to work, and then we're going to check that it's numb with our probe. So probe around the soft tissues around that tooth, make sure they can't feel any pain. The position of the chair, if it is a lower tooth, it is in the upright position, and we would support the head with our palms on the TMJ and our hands underneath the jaw. If it's an upper tooth, we have the chair back at 45 degrees, and you would support the patient's head just on the top there from upward pressure. The height of the chair just depends on the operator, and this is the only procedure where we allow you to stand up. So it's all numbed up. So before we commence any sort of the extraction, we would warn our patient they might feel some pushing and hear some sound effects, some tearing and some cracking. That's nothing to be worried about. So start off with an elevator to loosen the periodontal ligaments. Go in with the forcep, luxate and move the tooth around in a figure 8 motion. Tooth comes out, no celebrations yet. The operator must check they've got it all in one piece. If they give you the all clear, great, that's excellent. Then we can say, well done patient, just put some gauze in there and bite on that firmly, and then we can commence with our post-op instructions. So I've also got here, in case the crown snaps off, we might need to go looking around for a piece of root. So it's a good idea to just have apical elevators out ready on the side. If you don't use them, they're still clean, doesn't matter, we can put them away. But if you need them, they're there and they're quick and easy to grab. So post-op instructions, bite on that gauze firmly for 20 minutes. And we'll give them some spare gauze to take home and change later on if they need to. So all the don'ts for today is don't rinse out for today. It's very important that clot stays in position. Don't exercise, don't smoke, no alcohol, don't stick your finger in there and play with that socket or your tongue in there, it'll dislodge the clot. If there's pain later on, you can take something for pain relief, but no aspirin, it's a blood thinner, it's going to thin the blood. So, and as of tomorrow, warm salt water mouthwashes 3 to 4 times a day for 5 to 7 days. We would give them this as they leave, which is the instructions written down and the spare gauze. And the last thing we say, if you've got any problems, you must contact the surgery so we don't have any complications. Okay, so that's a routine exo.